Hello everyone, and at the outset I would like to thank Professor Gupta and his team to give an opportunity to ResMed to present what we have been doing in the world of digital healthcare. I would also want to express my thanks to Austrade. I think they have been doing a wonderful job in terms of talking about what's happening in different parts of the world, and Austrade team has been at the forefront of talking what's happening in Australia, and then how can India benefit from the technology piece which Australia is taking ground. And of course, I would like to thank the ResMed India team. For the last so many years, they have been working on a topic which does not even get recognized as a disease, which is obstructive sleep apnea and COPD. Interestingly, if you find the presentation boring, don't blame it on me. Maybe there's not enough good sleep that you would have had yesterday night. And in case you feel that there is snoring, there is breathlessness, there is daytime sleepiness, there is lethargy, go and get your sleep study done. And that's what we have been trying to do in terms of managing the chronic patients. It has been wonderful that how this presentation has been set up, and Reena talked about the chronic patient management and how 50% plus patients are actually suffering from chronic diseases. ResMed has been a global leader in connected and digital health. We aim to change so many lives across over a period. We have changed 150 million patients' lives in 1 year, helping them sleep better, breathe better, and live better. There are 18 million plus cloud-connected devices which throw up data every night, and that's the power of digital health that can help the physicians manage the chronic care patient journey so very well. We have 12 billion nights of sleep and respiratory data that is available for anyone to manage the chronic care patient journey for the patients. Actively, we work in 3 spaces. We have sleep health, we have respiratory care, which is COPD, and then we also have software as a solution, which is mainly US focused currently. And what we try to do across is to deliver better health care to the patients using the digital health technology. Now, the need of sleep health has never been greater. Now, COVID has provided a shot in the arm for many of the disease segments, and one of them has been the respiratory diseases. Sleep apnea is now getting recognized as one of the most important problems across that maybe there is latent need for solution. So we have approximately 1 billion patients globally who might be suffering from sleep apnea, 460 million patients plus suffering from COPD, and patients of insomnia to the tune of 800 million. And that presents to us an opportunity for what we are doing in terms of digital health to over 2 billion patients globally. Yet, we have been talking about since morning whether there is access to health. Is it equal in all parts globally? The answer is no. I think there is a lot that maybe this group needs to do and spread message of awareness to maybe the governments, to maybe the different private stakeholders, to the home care companies that exist. And of course, there is an unorganized market of channel partners who exist out there sometimes, just like the way we learned in the patient session in the morning. There are patients who, caregivers who care for the patients, but sometimes their value is not well appreciated. Similarly, I think there are channel partners across the length and breadth of the country who do not get that kind of admiration that they so much deserve. Now, what we try to do is, achieve the health equity through the digital technology that we have. Now, it has to be integrated in terms of the products, in terms of the services we offer to the consumers who have now become patients, and vice versa. And then we have to have business models which are integrated towards solution of this particular problem. And with that, there are 3 products that I would like to briefly touch upon, which is My Night, My Air, and AirView. Now, these are products which are the genesis of which is digital technology. And how we use it, My Night is basically an app which helps the patient, which is the consumer currently, to actually understand and undergo a sleep assessment. Now, it can be called a screening or it can be called a diagnostic, but definitely there is technology which is available for anyone to download an app and maybe a 3-night data of testing will help the patient based on sonar technology to understand the sleep pattern, and then they can consult with their physician or with their caregiver as to what could be the next step. But yes, there is a technology which is now available in the form of digital health. We have MyAir. We have 4 million patients which have signed up for MyAir globally. And there is a MyAir score which comes up, there is a sleep data, and then it also provides a way how we can educate the consumer who is yet to become a patient or yet to be recognized that he or she is a patient of obstructive sleep apnea. And this is available at zero cost. There has been version which has been launched in India. There are medical versions which are going to be launched in India. But abroad, it's very much available as part of the offering that we have from ResMed. When it comes to managing the patients, we have a solution which is called as MyAir. Now, MyAir is a companion for the patients who have been on the journey pathway for their own sleep health. Patients rising up every morning, they can see the reports as to how their sleep health has been there the previous night. Now, it gives them confidence. It also helps them to guide the journey because, as we mentioned, it's a chronic disease, and every night is so very important to have a very good day. When it comes to the technology piece, we have developed solutions for the providers, which are the channel partners or the physicians, clinics, and the hospitals, which can use the technology which has been part of maybe the last 2 decades of ResMed offerings. AirView is a technology which is cloud-based, where the same sleep data which is available to the patients in the form of MyAir is available on the convenience of a laptop, in the office, in the home of a caregiver, which is the doctor or the provider. Now, the data access is detailed at the convenience, and we follow the strictest privacy rules. And as India also evolves with the digital production data privacy rules, I think we are there upfront to help all the stakeholders, whether it's the government, whether it's the patient, or whether it's the doctors managing the patient. And it's just one click away. There are remote settings which can be managed. So if the patient is not doing well and is sitting at a peripheral town or in some other state in the country, today any doctor sitting anywhere can manage those patients in the India subcontinent. I think this is one of the things which has been in the respiratory space, in the pulmonology space. We have been trying to talk to various physicians that yes, patients who do not come back to you for consultation, you can actually use technology to reach them. With this, again, maybe there are slides which are quite similar in terms of the way we want to represent the consumer journey or the patient journey. There is a do nothing which is available for many of the patients, and many of the patients do not actually land up doing anything about that. But they need to understand the diagnosis, they need to have solutions, and they need to have an ongoing support. Now, what we have been trying to do is to provide those solutions. We have MyNight available as diagnostic, as adult solutions, and MyAir and AirView, which is now available for any of the provider to take care of the sleep health for their consumers, for their patients. And what we have been trying to do is move from hardware. ResMed is by origin an Australian company and now settled happily in San Diego. But yes, from hardware, we have been moving to digital and service design. Thank you very much for your kind attention, ladies and gentlemen. Awaken your best. Thank you.